Hi, so my name's Luca. I'm a clinical pharmacist at the Hurley Group, working across 3 sites at Hurley and Riverside Practice, Hall Lane and New Cross. Clinical pharmacist is a qualified pharmacist who studied at university for 4 years and then done an extra year in practice, who can help in the GP surgery with multiple areas. So the most obvious one is medication. Additionally, we can help with long-term conditions such as managing people's blood pressure, diabetes, asthma, COPD, etc., as well as helping with minor ailments as well, such as allergies, pain relief, and the contraceptive pill as well. The difference between a community pharmacist and a clinical pharmacist generally is in terms of the location. So the community pharmacists are the pharmacists that you'll see in your high street chemists, such as Boots and Day Lewis, etc. The qualification is still the same, so they're still equally as qualified to be able to help with conditions such as blood pressure. But obviously they won't have the information that you would do in a surgery. So the clinical pharmacist is based in the GP, has all access to all the information that your GP has, and will be able to advise on the conditions that I discussed earlier. Clinical pharmacists are one part of a large multidisciplinary team, which includes GPs, nurses, physiotherapists, social prescribers, and healthcare assistants. The GPs will lean on us to help with medication advice and with long-term condition management, and for any complex medication issues. For example, if somebody can't swallow tablets, if somebody's having an intolerance to one medication, needs to consider another one, or if a medication's not being as effective as it should be. We will also lean on the other professionals for their expertise. So when if we see a patient who we feel we can't deal with ourselves, it's out of our competency, then we will then seek advice from a GP or an advanced nurse, etc. A common concern I get from patients is why am I seeing a pharmacist rather than a GP or a doctor? And I totally understand that's a real concern that people have, to ask if we're qualified and whether we're the best people to be speaking to. And to alleviate that concern, as I said at the beginning, we have 4 years of training and an extra year on top of that in practice to make sure we're prescribing safely. We see in the day-to-day these common medical conditions such as diabetes, asthma, COPD. We're very competent at being able to manage that and make sure that treatments are up to date. It's often more appropriate for patients to see a pharmacist, as because we see this on a day-to-day basis, we're able to stay up to date with the medical guidelines and ensure that the treatment's appropriate. That's a little bit about being a clinical pharmacist. My take-home message would be, if you have any medical questions or any conditions that you'd like to be reviewed, then please do not hesitate to book an appointment with your pharmacist. We are here to help at the end of the day, so we look forward to seeing you soon.